I've received an order for insulin for my diabetic patient. Before I administer anything, I am going to go over the 6 rights, which is the right patient, the right dose, the right drug, the right route, and the right time, and the right documentation. The order calls for Humulin NPH unit 100 for 20 units of that subcutaneously, and then for a sliding scale for Humulin R unit 100. So I'm going to get those vials. This is my Humulin NPH. It's cloudy. Pretend it's cloudy and not yellow. It's cloudy. That's what I'm going to use it for. I'm going to check the vial for any cracks. I'm going to check for the expiration date. I'm going to check if it is a multi-use vial. I'm going to check the date and time that it was opened, because it's good for 30 days after. Again, this is the Humulin R, the clear. Again, I will check the vial. I will check the expiration date. I will check when it was opened, because it's only good 30 days after. I have my insulin syringe. I will now alcohol swab the pads. Quick slice. Put it on top so I know that I did it. I am going to open up my insulin syringe. Now it is asking for 20 units subcutaneous before breakfast of the NPH, which is the cloudy, and his blood glucose level is 245, which on the sliding scale gives him 10 units of the clear regular insulin. So what I will do is grab 20 units after I pull off the cap, grab 20 units of air, 20 units of air, and insert that into the NPH insulin. Remove, get 10 units of air, insert that into the regular insulin. Pull the regular insulin up, grab 10 units, Okay, get any air bubbles out. All right. And now into the NPH and grab 20 more, which will give me 30 units. I'll pull that out. Recap. Verify with another nurse that it is correct and that it correctly matches my order. Put the insulin away. I will go to the patient's room. Knock, knock. Hi, Mr. Sprocker. I have your insulin shot before breakfast. Can you please verify, tell me your first and last name and your date of birth, please? He says, I am Skip Rocker and I'm born January 1st, 1972. That matches my thing. I go back into the MAR, make sure that yes, I am supposed to give this before breakfast. Look at his allergies. I'm looking at everything. Everything's good. Then I pick a site. The sites for insulin are your belly, on the back where your love handles sort of are, and the back of your arm. Now I will put on clean gloves. Clean gloves. Okay, I'll take my alcohol swab, and on the site in the back, or on the belly, I am going to administer and clean in a big circle. I am going to remove the cap, hold the skin out taut a little bit, and go 90 degrees and right there. Okay, right, go 90 degrees and in. Holding it secure, I'm going to press the medication in. slowly. And then I'm going to pull straight out. I am going to recap the gauze for any blood. Recap and dispose of in the sharps container. Disposed of in the sharps container. Then I will document in the MAR that insulin was given at what time and how much.